Is it possible to improve any part of your fitness during pregnancy? And if so, how? I think maintenance can be a very appropriate goal during pregnancy, and we'll talk about how to do that. But many people shoot for maintenance, underload, and under-exercise, and therefore may not even successfully maintain. I am a huge believer that you can build strength and even muscle mass during pregnancy, therefore improving your fitness all without wearing yourself down. I'm just over 5 months pregnant myself, and I know that energy is not always there during pregnancy, so trying to commit to an overly intense routine just is not realistic. But it doesn't need to be that way. It takes the right dosage of exercise. It doesn't need to be extreme or beat you up. It can be both gentle and approachable while improving your fitness and all pregnancy outcomes. Most women spent 9 months of their pregnancies underloading their bodies, losing muscle, and then they lose more postpartum, and they struggle to get back to pre-pregnancy fitness levels because they've essentially spent a year deloading their bodies. I've developed a passion for empowering women that they don't need to be scared of strength training during pregnancy, but it makes sense that they are. There is not a lot of guidance around this topic. Women are traditionally encouraged to take it easy during pregnancy, and while current medical recommendations don't align with this, much of the general public still believes it. Being active during pregnancy is crucial. It improves almost all outcomes during pregnancy for both the baby and for the mother. The ACOG, the American College of OBGYN, states that physical activity and exercise in pregnancy are associated with minimal risks and have been shown to benefit most women as long as it's approved by their doctors. They also state that women with uncomplicated pregnancies should be encouraged to engage in both aerobic and strength training exercises before, during, and after pregnancy. According to a 2022 paper, 100% of OBGYNs agreed that regular exercise is recommended during uncomplicated pregnancies, and 94% of doctors agree that exercise during pregnancy has benefits that outweigh the risks. However, only 46% of doctors discussed how to exercise, so the time, frequency, intensity, and type. Despite well-documented benefits and OBGYNs likely recommending exercise to their patients, only 13 to 14% of pregnant women meet exercise recommendations. This is lower than the national average, where 24% of U.S. adults are meeting the exercise recommendations. A recent paper from June of 2024 indicated that only 11% of U.S. women practice resistance training despite the clear benefits, and out of those, only 1.2% were engaging in heavy lifting. In fact, in one study, over half the pregnant participants believed that weight-based exercise was unsafe during pregnancy. This goes to show that women are confused about how to exercise during pregnancy, and this confusion has consequences. Women default to avoiding strength training altogether or undertaking overly gentle routines that aren't effective for building or even maintaining strength and muscle. This loss of strength, muscle, and overall fitness can have both short-term and long-term effects. In the short term, the risk of gestational diabetes increases, energy levels decrease, and women are at a greater risk of postpartum recovery delays. Although pregnancy is a relatively short time period in a woman's life, neglecting proper strength training during this time can lead to kind of a downward health spiral with long-term effects. With a slower postpartum recovery, many women struggle to return back to baseline fitness levels, and many women feel like they never reach their pre-pregnancy fitness or health levels despite years and years of exercise later. And while this is totally normal and okay for your body to change after pregnancy, we ideally should be returning or even exceeding our pre-pregnancy health and fitness status. And how you train during pregnancy can set you up for success after delivery and into the rest of your life. So my hope is that this podcast will lift some fear, make you feel empowered, and help reduce the confusion around how to exercise during pregnancy. I'll provide you with what we know, the research gaps, and my professional opinion on how to apply what we know into a well-rounded routine that has the potential to improve elements of your fitness like strength, muscle mass, and potentially even cardiovascular fitness. Before we begin, I'll provide the disclaimer that this is not medical advice and that all of this needs to be passed by your doctor before implementing. Let's begin by discussing what the ACOG, the American College of OBGYN, recommends for prenatal fitness. According to a paper in the American Journal of Obstetrics and Gynecology, examples of exercises that have been extensively studied and found to be safe and beneficial include walking, stationary cycling, aerobic exercises, dancing, resistance exercise, hydrotherapy, and water aerobics. ACOG gives detailed recommendations on cardio, recommending at least 150 minutes of moderate intensity aerobic exercise per week spread throughout the week. They provide intensity guidelines recommending that women aim for ratings of perceived exertion of 13 to 14 out of 20. So that's kind of somewhat hard on the Borg scale. Additionally, women can implement the talk test to gauge intensity, which is exercising at the intensity in which you could still hold a conversation. As far as higher intensity cardio like HIIT, ACOG suggests that if you were doing it prior to pregnancy, you can continue with it during pregnancy all the way up to the very end when you deliver or before you deliver. Can you add it if you weren't doing it before pregnancy? ACOG suggests that the upper limit of exercise intensity hasn't been established yet, but that it may be safe to start if you are progressing gradually. In other words, you would want to slowly ease into higher intensity work with really short sessions to start, maybe once a week, and gradually increasing frequency as you're feeling good. If you do want to add HIIT and you weren't doing it prior to pregnancy, this would be something that I would recommend doing with the guidance of a trained professional. I personally don't do HIIT during pregnancy. I'm more focused on moderate intensity cardio and strength training, and will return to HIIT post-pregnancy for the VO2 max benefits or for the cardiovascular benefits. But right now, it's kind of on pause for me. What about resistance training? ACOG reports that strengthening the abdominals and back can minimize the risk of low back pain that is experienced by more than 60% of pregnant women. And there are many other benefits of strength training, such as improving insulin sensitivity and improving joint health. However, there's no information on intensity or dosage that is beneficial for strength training during pregnancy. Unlike the cardio recommendations, in which they give recommendations for intensity and dosage, the strength training guidelines are just not listed. One thing that they do mention is the guidelines for elite athletes. So they recommend elite athletes decrease resistance load compared with pregnant conditions. They also note that there's sparse literature on this topic, which likely leads to more conservative recommendations. So this recommendation for elite athletes to decrease load may only apply to a small percentage of the population who are regularly pushing their limitations in the pursuit of a sport or competition. This recommendation does not necessarily apply to non-elite athletes, which is most women. So if you are just a fitness enthusiast trying to stay fit, this recommendation may not necessarily apply to you. Despite a substantial amount of research supporting the importance of strength training during pregnancy, specific evidence-based protocols for prenatal strength training are really absent. Recommended weight loads, sets and repetitions, frequency, exercise selection, and intensity are not clearly listed. One recent paper attempted to provide more guidance around resistance training during pregnancy. According to the paper, light to moderate intensity exercise, so up to 80% of maternal maximum heart rate, are considered safe during pregnancy. However, heart rate isn't always a reliable gauge for strength training intensity. There are no recommendations for percentage of 1 rep maximum or how heavy the resistance is, which is really a more accurate way to gauge lifting intensity. This lack of precise definitions for light to moderate intensity resistance training is really part of the research gap. The authors of this paper note that dose-response relationship of strength training volumes and outcomes are unclear and warrant further studies. In short, there is not clear guidance for how to strength train during pregnancy. We know that it's beneficial, but we're not giving women guidance on exactly how to do it. Although there are lacking protocols, there are a couple papers that I want to mention here that might help you lift fear and give you a little more guidance around strength training during pregnancy. So one paper studied the benefits and risks of heavy weightlifting during pregnancy. The paper surveyed 679 women who engaged in heavy resistance training during pregnancy. And they defined heavy resistance training as 80% of 1 rep maximum, which for reference, this is pretty heavy, anywhere from 6 to 12 reps per set. The participants used a variety of lifting methods. About half of the participants engaged in CrossFit, while about the other half identified with just kind of weightlifting in general. Most of the women in the studies were performing Olympic lifts such as clean and jerks and snatches. They also performed supine movements, which means laying flat on your back like a bench press. They performed squats, deadlifts, cleans, things like that. Women from this study who maintained pre-pregnancy training levels until delivery reported significantly fewer complications than those who reduced training before their delivery. So the women that continued to strength train and lift relatively heavy weights had better outcomes than the women who backed off during their pregnancy. In other words, these women continued to train similarly to how they trained pre-pregnancy and had better outcomes. This group did show higher risk of urinary incontinence postpartum. I thought this was interesting and something I could note. So 57% of participants experienced postpartum urinary incontinence, which is higher than the general population rates at 32%. This could possibly be due to exercising too soon postpartum rather than the weightlifting during pregnancy itself. So they measured these women postpartum, not during pregnancy, and found that their rates of urinary incontinence were higher. This, again, could be because they weren't easing in. Gradual progression during postpartum is crucial for avoiding pelvic floor symptoms and urinary incontinence, so it could have been that they were doing too much too soon. It could also be due to ineffective lifting techniques causing improper pelvic floor pressure management while lifting. It could also be due to really ignoring signs and symptoms, pushing through things like heaviness, pain, leaking while lifting instead of modifying or seeking help from a pelvic floor physical therapist. So in other words, it may not be weightlifting itself causing urinary incontinence, and I don't want you all to be afraid of that. But rather, urinary incontinence may be caused by returning to exercise too soon or too intensely, improper breathing, which we'll talk about in a moment, or lacking self-regulation and modifications. So these women who lifted heavy really had good outcomes. Does this mean that you need to do CrossFit while pregnant? If you want to, that's an option, but many women don't have an interest in training like that, myself included. But there are other ways to build muscle and strength that feel more appropriate. More on that in a moment. Another study that I want to reference before we get into if you can build muscle and how to build muscle during pregnancy is a study from 2024. And this supports the idea that heavy lifting is both safe and beneficial during pregnancy, claiming that weightlifting with loads up to 70% of your 1 rep max, so that's about 10 to 15 reps taken close to failure or to failure, show no adverse effects on maternal or fetal outcomes. So where does all of this information leave us? From what we can see, lifting relatively heavy weights appears to be safe and beneficial during pregnancy. Pre-pregnancy fitness levels may influence what intensity is appropriate during pregnancy. So if you're newer to lifting, lighter lifting may be more appropriate. I'll give recommendations on that in a moment because you do have to lift heavy enough to see strength and muscle gains or to even maintain muscle, but it doesn't have to be super heavy squats for 6 reps. You have a lot of options on how heavy you need to go, and exercise selection is also very important. So before we get into how to strength train during pregnancy, is it even possible to build muscle during pregnancy? Hormonal shifts during pregnancy can affect the body's ability to develop lean mass and strength. So let's look at some of the hormonal changes during pregnancy and how they affect muscle growth and strength. So first, relaxin. Relaxin is a hormone that increases early in your first trimester, peaking around the 12th week, and then it decreases to 50% of peak levels until approximately weeks 17 to 24, and then stabilizes for the remainder of pregnancy. The reason that relaxin is important when it comes to strength training is that relaxin can decrease your joint stability and may increase your injury risk. I'm going to talk about this when it comes to exercise selection. Next, we have estrogen. So how is estrogen changing during pregnancy? Estrogen dramatically increases throughout the pregnancy and peaks in the 3rd trimester. Then we have progesterone. Progesterone peaks in the 3rd trimester. We have IGF-1, which is a hormone that's responsible for growth and development. This is actually suppressed in early pregnancy, but peaks in the 3rd trimester. This may be an optimal time for women to strength train, as in really the whole pregnancy, but especially even in 3rd trimester, to enhance skeletal hypertrophy because IGF-1 induces protein synthesis and blocks muscle atrophy. And then finally, we have testosterone. Testosterone increases throughout pregnancy, becoming significantly greater than non-pregnancy levels by weeks 13 to 16, and it reaches a peak by delivery. Testosterone increases muscle mass and strength. It can induce hypertrophy in type 1 and type 2 fibers. So that's an overview of how your hormones are affected during pregnancy. What does this mean when it comes to strength training and muscle development? The hormonal environment during pregnancy, especially in the third trimester, may be a favorable setting for muscle adaptations due to elevated testosterone and IGF-1 levels. However, due to an increase in hormone relaxin, it's especially important for women to choose exercises with minimal joint stress during pregnancy. This is where exercise selection comes in, which I'll talk about in more detail in a moment. What's even more cool is that in mouse studies, one paper suggested that pregnancy can improve the regeneration process in muscles and counteract negative effects of aging. So people think that building muscle during pregnancy isn't possible and isn't safe. And although we don't have definitive studies one way or the other to say that it's possible, theoretically and anecdotally for myself and others who have done prenatal, pregnancy can be a great time to increase muscle and strength. So we've talked about what we know about fitness during pregnancy. Let's talk about how to build muscle and strength during pregnancy. Really, the basic principles apply for everyone to build muscle and strength. This goes for regardless if you're male, female, your age, whether or not you're pregnant. The basic principles really do apply. So you'll follow my reps framework, but just with some specific modifications for pregnancy. So the reps framework is to help you eliminate confusion and guide you on structuring a routine that has the most impactful elements necessary to build muscle and strength. Again, we just want to modify a couple things to make it work during pregnancy. So let's go through this in case you're not familiar with this framework. Number one is the R. R stands for repetitions. As I alluded to earlier, you have a lot of options when it comes to how heavy you can lift to build muscle and strength. However, lifting too light, which is what a lot of women default to during pregnancy, won't result in much change. The literature indicates that you can build similar amounts of muscle with heavy weights and fewer reps, so let's say 6 reps with really heavy weights, as you can with lighter weights and higher reps. So let's say you're doing 25 reps with lighter weights. As long as you are approaching muscular failure in less than 30 reps, you are lifting heavy enough to build muscle. So for context, let's take a chest press. I can do about 15 reps with 30-pound dumbbells in each hand. I could go heavier and do fewer reps, maybe get 8 reps with 35s. Or I could go lighter and do more reps. Maybe I use 20 pounds and do 25 reps. But 10 pounds may be too light for me. I may go far beyond that 30 rep threshold and therefore not be stimulating much muscle growth or strength. So there's an upper limit. If you're questioning if you're lifting heavy enough, try to do more than 30 reps. If you can do more than 30 reps, it's too light even during pregnancy. You also need to approach failure in each set. And this is something that women get afraid of during pregnancy, but you absolutely can continue to train close to failure as long as you're choosing wise exercise selection, which I'll talk about here in a moment. You don't have to get all the way to failure, meaning failure means you can't physically perform another rep no matter how hard you're trying, but you do need to get a few reps shy. You know you're close to failure when your rep speed slows down, when you feel like you almost get stuck halfway through the movement, and when you have a sudden spike in your heart rate. The burn and overall fatigue are not reliable gauges of intensity, so don't stop an exercise just because it burns. In fact, the discomfort of the burn often distracts people from getting close to failure, and so they stop before they reach those highly stimulating reps at the very end. If that's happening to you, go heavier and make sure that you're stopping an exercise because you are truly slowing down, not because you're bored or it burns or you're overall fatigued. Again, you can train close to failure during pregnancy. If you were lifting heavy prior to pregnancy, you may be able to continue with that. If you are newer to lifting, you may start with higher repetitions and lighter weights. So maybe in that 15 to 30 range instead of going really heavy for low reps, but still try to approach muscular failure. In the prenatal program, we're typically doing around 15 or more reps, but know that you can always adapt that by doing more reps or less reps, depending on kind of how you're feeling and your fitness levels and what you're comfortable with. So that's the R in the reps framework. Next is E. E stands for exercise selection. This is always important regardless of your pregnancy status, but it's particularly important during pregnancy. This is because, as I alluded to earlier, relaxin increases during pregnancy, making you more flexible, but it can make you less stable, especially when you're weightlifting. The risk is that you can injure yourself by loading deeper joint positions or unstable joint positions. However, there are ways to continue loading your muscles while keeping your joints safe. First is to choose exercises with multiple support surfaces. So think using a wall in your hand or leaning against a wall or laying on the ground or laying on a stool or using a ball underneath you, using lots of support objects so that your body increases stability. I recommend this for everyone because what's cool is when you have greater stability and your body senses it's in a more safe environment. So this means that you're at a lower risk of injury, but the muscle is still getting high stimulus. This is especially helpful during pregnancy because of the increased joint laxity. And you also may have decreased what's called proprioception. So your ability to kind of sense your body in space. So using lots of ground and wall and prop support can be really, really helpful during pregnancy. For example, a ball wall sit is an excellent quad exercise during pregnancy. This is where think of having a ball behind your back, like a small Pilates ball. You can even use one of those big exercise balls behind your back. You can hold weights on your thighs or one across your thighs or one across your chest and slide up and down the wall. And the reason this is really great during pregnancy is because it limits load to the spine. You get really stable. You have lots of points of contact, 2 points of contact with your feet on the floor, and then you've got the point of contact with between your spine and the wall. And this is great because it limits load to the spine while really effectively loading the quads. It's also great if you're someone that experiences any kind of pelvic or low back pain during pregnancy. I'm not saying it's solving your back pain or your pelvic pain, but it allows you to continue to work your muscles around any pain without making your pain worse. In that exercise, another example for the glutes is a B stance lunge using both a chair and a wall. This was one of my favorite glute exercises during my first pregnancy. So you stagger your stance with one foot slightly behind the other, hold a weight in one hand, and then lean against a wall with the other. You sit back into a chair so you have the chair stopping you from going too deep, and then push off the front foot to stand. Again, lots of support with the chair, 2 feet on the ground. You've got the wall, you've got the chair behind you. So there's a lot of external stability so you can really focus on load to the glutes. I have tons of examples on my Instagram. I have a saved highlight called Pregnancy Number 2 Workouts where you can see more examples if you're curious. You can also join the Evlo membership and do the Evlo prenatal program that I taught in my first pregnancy, or just even use machines at the gym. Aside from the exercises you're choosing, how you are doing them is important. Your form may change during pregnancy. Again, you have increased range of motion availability. You potentially have decreased proprioception, so your awareness may be kind of off. So filming yourself can be very helpful. You may also consider limiting how deeply you sink into postures, especially hinge movements like lunges and squats and things like that. So only go through the range of motion in which you can control and connect to your muscles. Breathing is also crucial during pregnancy and applies to kind of exercises and how we're doing exercises. We want to avoid bearing down or pushing down during lifting, almost like you're trying to go to the bathroom. This can put excessive pressure on the pelvic floor. So when you lift, breathe out through pursed lips and imagine your lower belly lifting up. If you struggle to coordinate this or if you're unsure, I do recommend seeing a pelvic floor PT who can do an internal exam and feel if you're coordinating your pelvic floor correctly. Especially if you're having symptoms like heaviness or that feeling like a tampon's falling out or having any pelvic pain, I highly recommend going to see a pelvic floor PT. What about laying flat on your back or doing exercises in a supine position? Are you allowed to do that? Is it safe during pregnancy? Let's talk about it. Many pregnant women can safely exercise on their backs for short periods. Pass it by your doctor and also monitor for any symptoms of dizziness, lightheadedness, sudden increases in heart rate. And if you experience any of those, take an inclined variation with your trunk slightly inclined up or choose a different exercise where you're seated, side lying, or upright. We have lots of options in the Evlo prenatal program that walks you through that in the second trimester and third trimester foundation classes that you'll take when you're joined. So you'll feel like you really have your hands held there. So in short, most women can safely exercise on their backs during pregnancy, but again, pass it by your doctor and monitor for those symptoms. What about abdominal work? This is another fear that women have, is working their abs during pregnancy. Abdominal work is generally beneficial and safe during pregnancy. You can continue to do crunches, planks, and most any abdominal exercise as long as it's comfortable. It's not shown to be harmful for the baby. The caveat is that you want to maintain your intra-abdominal pressure. So watch for coning or doming, which is a bulge down the midline of your abdomen. If you're seeing that occurring, try your pursed lip breath. So modify the exercise or maybe even hold some isometrics. Again, these are things that we walk you through in the membership, and there are pelvic floor educational videos inside the membership if you need more info. I think this is something that women are very afraid of, and it's truly nothing to be afraid of. Highly recommend going to watch the pelvic floor workshops, and they'll really help lift your fear around that. I did one with Dr. Amelia, who is a pelvic floor physical therapist, and she did a ton of education about coning and doming. So that's inside the Evlo Prenatal membership. What are contraindications during pregnancy? What exercises should you avoid? So laying on your stomach after a second trimester is generally the only kind of strict no-no during pregnancy when it comes to exercise selection. Most everything else can be done with discretion, modifications, and proper breathing. All right, so that's exercise selection. That's the heftiest one when it comes to pregnancy out of these four. The next is P. P is for protein. Just like I recommend high protein diet before pregnancy, I also recommend it during pregnancy. Our registered dietitians that we work with recommend eating between 0.75 and 1 gram of protein per pre-pregnancy body weight throughout the duration of pregnancy. And finally, we made it to S, which stands for structure. This is a piece that many women struggle with because they bounce around between lots of different methods and fitness modalities, thinking that you're getting the benefits from all of these methods, when in reality, many times it's distracting you from achieving any one goal and potentially overusing your body, creating unnecessary fatigue and negatively influencing your recovery. So having a structured routine where you are working each muscle group 2-ish times per week on non-consecutive days is very important. You want about 48 hours of recovery between muscle groups. So if you work glutes on Tuesday, wait until Thursday at the earliest to work the glutes again. I recommend taking 2 days off resistance training each week. These are your active recovery days where you're getting in your cardio. This is where I'll do my longer walks or my hikes, and I'll kind of chip away at my 150 minutes of light to moderate intensity cardio that is recommended for everyone, but is especially recommended during pregnancy. So that's the basics that will build muscle or strength during pregnancy. Just to quickly summarize, the REPS framework, the R stands for repetitions, getting close to failure in 30 reps or less. The E stands for exercise selection, choosing really stable exercises, breathing correctly, modifying if you need to. The P stands for protein, eating 0.75 to 1 gram of protein per pre-pregnancy body weight. And the S stands for structure, working each muscle group about 2 times per week on non-consecutive days and taking 2 days off lifting where you get in your light to moderate intensity cardio. So maybe you're hearing all of this and you're saying, I don't want to build muscle. I don't want to build strength. I just want to maintain. So let's talk about maintenance. The maintenance literature suggests that you can do as little as 1 set per week per muscle group and maintain, or some people can even build muscle and strength. However, the intensity of that set is important. You need to take it near failure in under 30 reps, as I described in the R portion of the reps framework. So that's doing 1 set for glutes, 1 set for quads, 1 set for abs, 1 set for shoulders, 1 set for chest, 1 set for every major muscle group in your body, taking that set close to failure. Many women resort to lighter weights and higher reps like Pilates and bar, thinking that this will be enough to maintain their muscle and strength, and this may not be enough to even maintain muscle and strength. This is because your larger muscle fibers require higher tension to stimulate and load. And if you aren't stimulating those muscles, your body will begin to break them down. Our bodies will keep a good composition of our type 1 muscle fibers, which are generally used in those higher rep, lower weight methods like some Pilates and bar methods. So even if you need to do less during pregnancy, I still recommend focusing on at least 1 hard set per muscle group per week, taking that set close to failure in under 30 reps. Let's talk about if you can start something new during pregnancy. This is a question I get all the time. ACOG states that if you are starting something new, do so gradually and speak with your doctor first. If you're starting the Evlo prenatal program, maybe that means using lighter weights and not worrying so much about getting close to failure for the first couple of weeks. Just get the movements down, learn proper form and modifications, and then once you ease into it, start to lift a bit heavier and focus on getting close to muscular failure. What about signs and symptoms that you're doing too much? These are really important to just know about, not to freak you out, but just know that they exist. So some signs that you want to immediately stop exercise are vaginal bleeding, abdominal pain, regular painful contractions, amniotic fluid leakage, dyspnea before exertion, dizziness, headache, chest pain, muscle weakness affecting balance, calf pain or swelling. If you experience any of these, stop exercise immediately and call your doctor. Some yellow flags in which you may be aware of are pelvic floor symptoms or musculoskeletal symptoms. So pelvic floor symptoms are things like if you're feeling heavy kind of in your pelvis, or the sensation of a tampon falling out, or pelvic pain, or leaking urine. Those can be symptoms of pelvic floor dysfunction, and I would recommend modifying the exercise right away, and then contact your doctor and see if you can get a pelvic floor physical therapy referral. You also shouldn't have pain anywhere else in your body. So not just like in the pelvic region, in your knees, in your back, and your shoulders. So if you're feeling pain, modify the exercise. You never have to do any one exercise, especially if it's giving you pain. And Evlo, we're big about this. And this is why in the circuit tab, we have alternative exercises that you can choose from. We have so many different exercises that are 1-for-1 swaps. So make sure that you're continually checking in with your body, modifying things. Exercise should feel good. It really shouldn't hurt. Again, I don't tell you these things to scare you. I didn't have any of these in my pregnancy, but it is good to be aware of them. Let's end with a practical schedule in which you could implement during pregnancy. I really recommend that strength training is the cornerstone of your routine during pregnancy and thread in 150 minutes of cardio from there. So plan out how you're going to work each muscle group 2-ish times per week on non-consecutive days. Plan to work each of those muscle groups for 3 to 4 sets per session, taking every one of those sets close to failure in 30 reps or less. In Evlo Prenatal, this is all planned out for you, so you don't have to worry about any of it. You just press play on the class of the day. From there, plan when you're going to do your cardio. I walk almost daily, and I either teach or take the steady state classes on Evlo 1 to 2 times per week. Towards the end of my pregnancy, walking was my primary form of, or my only form of cardio, because it just felt better than jumping, because eventually you just get bigger. And so jumping doesn't feel as good, or at least it didn't feel as good for me. So I didn't do as much steady state towards the end of my pregnancy. I tended to just walk. But if you aren't having any pelvic floor symptoms, or if you feel good jumping, you absolutely can keep impact throughout your pregnancy, as long as, again, you're monitoring your symptoms. Any form of cardio that you enjoy and you can stay consistent with is great. Biking, swimming, walking, dancing, whatever it may be, just try to stay active. Again, shooting for those 150 minutes of light to moderate intensity cardio. This intensity is where you should feel your heart working, like you feel your heart rate get up, but you could still hold a conversation. If you follow these principles, you will have a healthier pregnancy, and they can potentially improve your strength and muscle mass while you're pregnant, improving your outcomes both in the short term and in the long term. My hope is that it doesn't feel so overwhelming and scary. The prenatal workouts are 35-minute classes 5 times a week, and you can even skip Thursday's class if you need to and still see results. I hope this was helpful. I hope this was empowering. I hope you learned a lot. We'll see you all next week, same time, same place. Bye for now.